system or a hospital. And when I talk to health leaders, I ask them these basic questions. Is your special order delivery rate above 5%? And what a special order is, it's an item that is needed, and it's usually needed the same day or the next day, that tends to not be on contract, and you pay additional cost, retail cost, because it's not on contract, plus the added urgent delivery rate. So you're paying a lot of money for an item that, if you order it regularly, could be on contract and normally distributed to your organization or brought to your organization at a much cheaper rate. So a lot of times, healthcare organizations, hospitals and health systems will see their special order rate creep up because they don't have time, at least that's what they say, they don't have time to manage these special orders. But what you'll find is a huge cost mismanagement. A lot of money spent on an item that doesn't have to be that expensive, and it raises the cost of supply chain and the inefficiency of the supply chain with special orders. The other issue is, do you have multiple vendors for supply items? Sometimes a hospital will have 4 or 5 or 6 different vendors for an item that they use routinely. They have a high volume and they use multiple vendors. And I understand when they use multiple vendors to reduce the possibility of disruptions in supplies, but usually they have multiple vendors because they haven't been disciplined in having volume-based contracts with primary and secondary and sometimes tertiary vendors, and get it down to a small group of vendors, not a large group of vendors for items. And if you do this for multiple items, you can see this becomes a major problem in managing your vendors and your contracts. The other question, does senior leadership have strong professional relationships with their top vendors? Some hospitals, the senior leadership knows who their top vendors are. They know where they're spending 30 more with it is very critical that senior leaders of a healthcare organization have strong relationships with their top vendors, because that's a critical issue for the ability for a hospital to perform their mission, is to keep their supply chain very functional and active and managed well. And it has to be managed from senior leaders all down to entry-level leaders. Are personnel doing the right jobs at the right time? For example, do you find a lot of nurses doing supply chain tasks on their floor, on their ward, when they should be doing patient care tasks? And if you have nurses spending 10, 15, 20% of their time doing supply chain tasks, that takes them away from patient care tasks, which is why they're there. It also is a cost inefficiency, because if you have a good trained supply chain technician doing the tasks that a nurse has been doing, the cost of a nurse is more than a supply chain technician. And that supply chain technician can do a lot of those functional work of some of your clinical staff. There is a right place and time for clinical staff to get involved in supply chain activities, but restocking shelves is not one of them if it can be done by a supply chain technician. Is supply chain cost management part of your culture in the organization, all the way down to the bedside, where patient care is delivered? There needs to be a discipline in supply chain cost management. Product waste, pilferage, shrinkage, using the wrong materials with the wrong patient, all those things require a discipline and a culture in an organization, and it really does help your cost management when everyone is aware of the cost management implications of making bad decisions. The other question is, are your processes standardized and efficient? And a lot of organizations in healthcare, and I've seen this across the globe when I used to work for the military in Europe as well, they put technology in place, but they don't standardize the business, the human process. And they think technology is going to solve their problem. Well, what technology does is it makes their inefficiency become very efficient. They become very efficient at being inefficient when they don't standardize the human processes first. And then the technology reinforces the proper, standardized, efficient application of a process. So if any of these issues are important to health leaders, there's a lot of work that needs to be done with efficiencies and improvements to the supply chain. In the United States, for example, I pulled this up back in 2014. They said that the typical total supply chain cost was around 40 to 45%. I usually see between 30 and 40% of annual operating expense is attributed to supply chain. The majority of the rest of the cost is labor, with very little going back to capital replenishment, capital replacement, which is very important. So supply chain becomes a huge part of their annual operating expense. The interesting thing is, in a lot of bachelor and master's degree programs in the United States, supply chain courses and information are usually rare and not the norm. So there's a lot of opportunity in supply chain expertise improving healthcare supply chain in the United States. And it's because a lot of the senior leaders in hospitals and healthcare never had supply chain courses or supply chain background. So they're not comfortable with supply chain, so they ignore it, or they hand it off to somebody else, or they push it down to a lower level leader. And they never hear the wisdom and the management science wisdom that comes with an expert in supply chain making strategic decisions or adding strategic information to a senior leader decision in the C-suite, for example. That's a major issue, and we'll see this more later in the presentation as one of the recommendations that needs to be carried out. Supply chain management is really an integration of flows of products, information, services, and finances from the point of origin to the final customer and the internal management of those systems, as you well know. And it's an important area for growth across the globe. Supply chain management is a huge area, and it really hasn't got its deserved attention. I think we're starting to see supply chain management attention in academia as well as in large Fortune 500 companies becomes more and more acute, and that's important. Healthcare needs to follow that argument from Fortune 500. But you also can see in supply chain management, when it's mismanaged, you can see huge costs associated with mismanagement. So, senior leadership team, a customized supply chain program, highlighting the basics along with the opportunities that could come with improving their supply chain, creates a great opportunity for health organizations. So certification and the various certifications you can get in supply chain for leadership in the supply chain arena is important and valuable. The education you're getting as managed and led by your dean is critically important for you to make a big difference in the world, in whatever industry you're going into, but especially in healthcare supply chain. I'll just touch on this briefly. Supply chain in healthcare is complex. And the reason it's complex is because we're caring for people. And I'll give you one example. Do you go to the hospital that says, we want to take care of you and we're going to make you feel better and we're going to correct your problem? Every time, 100% of the time, when someone comes into our hospital, we're going to make them better. Or do you go to a hospital that says, you win some, you lose some. Not everybody does so well. You don't want to go to the hospital that doesn't really show they care, that they take care of you. Supply chain has to be done very, very well because the technology of care is put in the hands of caregivers. And that's the supply chain in action when people come out of the hospital well. And we want people to come out of the hospital better than they entered. We want them well. And that's part of the complexity, because the error, you don't want a high rate of error in healthcare. So every organization is part of a supply chain, whether they produce a product or service, and that's true in healthcare as well. This is just a simplistic view of the healthcare supply chain. There's a lot of levels and moving parts, but at the end of the day, you want to get the right item to the right provider for use on the right patient at a reasonable cost, at a right level of quality every time. And that's why it's complex. What makes up the functional areas of the total supply chain are these 5 elements in most hospitals and health systems. The medical and surgical supplies, those are the things you normally think of in a hospital. Sutures and gauze and cotton balls, syringes, those are usually called med-surg items. Then you have pharmaceuticals, and those are medicinal and biological treatments, such as tablets, pills, injections, and those things are called pharma items. Then you have equipment, from IV stands to MRI machines to X-ray machines to scrubs, lab coats, etc., and that's part of the equipment. And then you have contracts for services like housekeeping, maintenance of the facility, those type of things. And then facilities. And a lot of people forget this. Most hospitals and health systems have a huge amount of facility supply chain function, such as liquid oxygen, right? They have all sorts of gases that are managed by the supply chain. Specifically, when you look at it from a clinical perspective, there's 4 types of items in the supply chain in healthcare. There's commodities, things that are easily substituted, printer paper, pens, desks, etc. Then there's clinical commodities that you use on patients for patient care. And then there's clinical staff preference items such as gloves or scalpels. And I'll tell you, if you go out and just buy any old glove for a clinician, they get highly upset. They usually have specific requirements. For example, they wear gloves all the time. And if they have a latex sensitivity, their hands will get all red and swell because they wear gloves all the time. So you really have to be careful when it's a clinical staff preference item, and be very selective and talk with your clinicians about what items are important to them and why they need them in a specific type or fashion. And then there's physician preference items that physicians really need to be involved with. And those are usually high volume, high cost items. For example, cardiac rhythm items, pacemakers, catheterization stents, things that are inserted in patients. Knee replacements, hip replacements, those type of things are usually high volume, high cost items. And those need physician interaction. Then logistics versus supply chain. As you know, a supply chain includes all of the logistic management activities. And it's really getting that material, that supply chain item, all the way to bedside, into the hand of the provider, the physician, the nurse, to make the patient better. High quality, high level of good outcomes, and not make mistakes. So it requires that good quality item that's the right item at the right time to take care of the patient. Some of the common terminology used in healthcare supply chain: sourcing is, how do you get the evaluation of what to purchase? And once that evaluation is done, how do you acquire that item? Then how do you move that item to your location? How do you store that item properly? And that includes all sorts of things. Because in a hospital, it's like a miniature city. You have food items, to biological items, to radioactive items, to items that expire with short shelf lives. You have everything under the sun, to include gases, like we just talked about. How do you store all those things? Most hospitals have as many refrigerators and freezers as all the cafeterias in a university, if not more, because they have to store those type of items. And then how do you dispense that item down to the bedside and get the right item to the right provider for the right patient at the right time? And then again, patient safety, cost of care, and quality of care, along with access to care, are all connected to the healthcare supply chain. A lot of times this is hidden. People don't realize that. But can you get an MRI if your MRI machine is broken? You can't do it. Can you get a PCI done, a stent in your heart when you have a blockage, if you don't have the proper drug-eluting stent? You can't do it. So it impacts access to care. It impacts quality of care. If you don't have a reasonable cost for the items, it impacts cost of care. And ultimately, it can impact patient safety. What if you don't have the correct endotracheal tube in the emergency room and you have to use the wrong size on a patient? That can be a patient safety item. So you always want extra, what they call ET tube number 7s. You always want number 7s plenty in hand in the ER and in the operating room. Whoops. There's a lot of direct cost, obviously, the cost of the item and the cost of moving it, the logistics cost, the cost of storage, but there's a lot of indirect costs as well. For example, training physicians and other staff on specialized storage needs or specialized devices. That's usually a hidden cost. And then there's a hidden cost of waste, pilferage, or shrinkage. For example, you can walk into a lot of warehouses, in healthcare warehouses, and you definitely don't want a rodent problem. One rodent can destroy thousands of dollars worth of medical supplies overnight just by eating through the boxes. You have to get rid of everything in the box because you don't want a rodent touching something that is used for patient care. So you have to attend to all those things along the way, and there's indirect cost as well as direct cost associated with it. Healthcare treatments have grown in complexity over the years. Thank goodness. Someone asked Dr. Friedman, who was a health economist, they asked him, this was about 25 or 30, 40 years ago now, why are pharmaceuticals so expensive? And he said, there's a simple answer. Today, pharmaceuticals work. They work better today than they ever have. So do medical devices. And because they work so well, there's an increased cost to those things. For example, on the next slide, take a PCI, a percutaneous coronary intervention. It's a stent in someone's heart. They have a blockage. Or a stent in someone's vein in their leg, for example. They have a blockage and they've had clot problems. Well, those PCI procedures require what they call now drug-eluting stents. There's drugs in the ceramic mesh of those stents that come out to keep the stent from being rejected or keep it from moving, reduce infection, all those things. Well, those stents now that have drugs embedded in them cost far more than what they used to cost. So the quality of care and the outcome for the patient is better, but the cost of that care has grown tremendously. Back when I first started working in healthcare, this was a few years ago, about 36 years ago, a basic stent was about $400 or $500. Now, some of the stents exceed $6,000 per stent, and you would have a hard time grabbing it with two fingers because they're so small, but they're so good at what they do. So it's really incredible that we've come this far in the technology of care, but the cost increases because of it. And that gives opportunity for supply chain where we can get the best cost for the quality of care that's required. Because now, no one wants to get a stent in a hospital that's not drug-eluting, because the standard now is to have a drug-eluting stent. So you're going to have more cost, and that leads to quality of care. Various disruptions we talked about a little bit earlier, but with every important critical supply chain item in the healthcare space, make sure your safety levels are adequate, and make sure you have backup vendors for critical items. You don't need to have 4 or 5 or 6 vendors, but having 2 or 3 vendors as backup for very critical items and items that are hard to get makes a lot of sense. So that redundancy and duplication for critical things that are needed is essential today. And like I said earlier, healthcare lags behind the industry, the rest of the industries. They tend to be anywhere from 10 to 20 years behind other industries with regard to supply chain. So the need for your expertise grows every day. So study hard, do well, get your certifications, and go out and do tremendous things, because there is a need in the healthcare supply chain for experts in supply chain. So here's some other things that cause disparities in the supply chain: multiple systems, multiple processes, lack of cohesiveness and uniformity, no standardization. Standardization is really required across the supply chain to really manage it well. High distributor fees, where you're paying a premium for distributor fees when you don't have to, not understanding there's sales tracing fees built in that most hospitals may not know about, and that's the fees that are paid by the buyer to tell the manufacturer through the distributor who sold what to whom. Well, that's almost ridiculous in today's automated society. You know whose region this was sold in, so you shouldn't have to pay extra to tell them what they already know. Service quality failures, service frequency failures, wholesalers lead your pharmacy process. You don't lead what you want. Inconsistent management, limited use of data. So having those fresh eyes and experienced minds to improve the healthcare supply chain really is what's needed. So earning those credentials so that you can be the eyes and the minds to make those improvements really is what's exciting about the next decade, and especially for you in the midst of your learning and work in supply chain. Just talk a little bit about value chain. Understand what the value chain is, that every step in the process should add value. Doesn't mean it needs to add monetary value, but it needs to add value to the process, value to the patient care, value to the quality of care, and leveraging analysis of value chain. And I'll just touch on this quickly. This is done through assessing the value added by every activity. And then these are the steps. I'm sure you've seen something similar to that. But do a value chain analysis on any major purchase or any major contract that you're doing in the supply chain world. Savings in procurement is another efficiency that can be done. Volume discounts. If you can guarantee volume, then your vendor should lower the price because they can get volume on raw materials for the manufacturing. You can also improve staff satisfaction. We talked about the nurses before, but also creating training videos for basic functions, requisitioning, internal customer requisitioning, internal customer storage requirements. And you need to have videos on the internal web for the hospital or health system, because the hospital has shifts. Not everybody works day day shift. They work nights as well. So you have to have those videos available for them to learn about supply chain basic functions. It gives them a comfort level and it improves their satisfaction with the supply chain operation. Here's some of the things I've been saying before. And really, how efficient and efficacious. Efficacy is how much good can you do for someone. You know, a health system is efficacious if they do good and help someone get well. So how efficient and efficacious is your supply chain? Can you get the right product with the right quantity, the right condition, to the right place at the right time for the right patient at the right price? If you can do those things, then you're highly efficient and efficacious. If any one of those things falters, then we worry about the cost, the quality, and the access for patients. When I started working in supply chain, 1987, most everything was pencils, and we also used key punch cards to do the monetary transactions way back when. So I thought this was appropriate. Pencils to keyboards to touchpads, all the way to electronic systems. We've evolved so much in the last 35 to 40 years, but we don't take advantage of the adaptive and technical changes that need to be considered and get the most out of them. So this is a supply chain interface map. This was from a project I did with Sisters of Mercy some years ago, but it really becomes managing information. Information and managing that information is just as important as managing the supplies you have, because the information allows you to make good decisions along the way to have a cost-effective, efficient, and efficacious supply chain in the healthcare space. Understanding data management and information flow is very important. You have to have access and visibility in the information at each step of the process for you to manage the supply chain well. And really, data needs to help you answer some basic questions. What needs to be ordered next? What has not yet been delivered? Do you have disruptions in the supply chain? And what types of products will we need in the future? And that gears up every step of your supply chain operation, from sourcing to acquiring to moving to storing to dispensing. You have to have visibility in all your data across the supply chain continuum. How your data standards in the enterprise resource planning system, how do you manage your data standards and keep them up to date? And I'll give you one example on the next slide. It's very important. How do you manage additions and deletions of your item master? Your item master is a list of everything that can be ordered and used within your hospital or health system. How you manage that and how you place items in that ERP system. Do you place your contracted items at the end of a long scrolling series of lists? No, you put them up top, right? You want people to use contracted items that have a better service, delivery, better cost. Of how you add item master items. Just as important to manage your vendor master. What vendors do you use and what contracts do you have with those vendors? What are the terms of those contracts? Transaction history file, which is a file of all the transactions you've done, so you can assess those. And I like to use simple Pareto analysis. Make sure we're using contracts that have been executed, that we get the best price, and we get delivery as scheduled, and really go through those files. And you'll find in the transaction history file if they're doing special orders outside of contract as well. And those are things to work on. Also understanding contract elements, such as delivery and payment terms, and you have to monitor all these things. Contracting is a perpetual process. As you finish one, you're gearing up for the next set of contracts, because the hospital and health system usually have hundreds of contracts. Everything really should be linked to the information system, and you really need to have your human process and your technology system working together. So if you're not efficient and you're not standardized, then your management of the supply chain is lacking. But if your information systems are linked to processes that are standardized and they're efficient and everybody's trained to use those standard processes, then you will be efficient. And I'll run through this very quickly. You need, when you have an information system that's working well and you have standardized processes, then your metrics are able to help you manage the supply chain. And some of the basic metrics we'll get to is inventory turnover rate, contract utilization rate, and Omar has the slides, and you're welcome to ask for these, and you can read more about it. Supply attribution value, stock inventory fill rate, pharmacy inventory fill rate, delivery date accuracy. All those are important, along with several others, but those are the ones people usually miss, is what I put here. So, improvements to operations, informed management, and quality leadership strategic decision making are facilitated with the ability to have timely metrics, operational statistics, cost reports, and integrated information. And it has to be coupled with patient information so that you see that the quality outcomes match the supply chain operation. Because if all your metrics are wonderful and you're not taking care of patients, it doesn't matter. It all has to work together. So what can be improved? What I've noticed over the last at least 15 to 20 years is every dollar invested in improving the healthcare supply chain results in a $2 to $6 return. That's a kind of stock market you want to be involved in. That's a great return on $1 of investment in improving the healthcare supply chain. So here are some keys to better supply chain performance. I'll just hit on a few of these, and this is from Eugene Schneller, who wrote a lot about healthcare supply chain in the United States, really starting in the 1990s through the early 2000s. Senior leadership management involvement. Optimize your supply chain. That's a strategic goal. Integrate financial and clinical decision making. You have to have an organization of your cost management focus. You have to have a culture of cost management. Tracking of performance measures. End user accountability for supply cost management. For example, if your end user is opening your intermediate packs and ruining 20 chucks, for example, and only using one or two, it makes no sense. You're wasting a lot of money. Have physicians involved in supply chain activities, especially in those high cost, high volume physician preference items. Control new technology and make sure your human processes are standardized and reinforced by the technology. Don't let the technology drive your train. Jay Conger, who is a great leadership scholar, he says, technological change cannot drive adaptive change. And what he was saying is, don't let technology tell your people what to do. Train your people to do the right thing and standardize them first, and then have your technology reinforce the good behavior of your people. And that works well. You have to have business skills, information, and processes that are in place. You got to be involved with your suppliers, and they need to be involved with you, and you need to align incentives. And likewise, in one of my books that came out in 2007, all these factors are still important for healthcare supply chain. You have to have information system usefulness. You need to push electronic purchasing, EDI, electronic data interface and integration. You have to have your senior leaders, your CEO, COO, CFO, CIO, have some level of supply chain expertise. And I would also argue that a supply chain executive needs to be in the C-suite with the senior leaders when the important decisions are made, because it's 30 to 40% of your annual operating expense. Supply chain expenditure details and management of those details are important. You need to have physician and surgeon level of collaboration, especially in those high cost, high volume items. Nurse and clinical staff collaboration as well, especially on those clinical items. You need to have the full leadership team's political and social capital to push improvements to the supply chain. And you need to have some capital funds available to invest in technology and invest in those improvements so that you can make a difference for your patients through your supply chain expertise. And I thank you. We ran through a lot of slides quickly, but I really appreciate being able to present to all of you today.
Thank you very much, Jerry, for this impressive presentation. It's very sharp and to the point. You went through very important milestones in the supply chain healthcare, especially when it comes to the top management commitment regarding how to migrate the supply chain principles into the healthcare sector and the services that should be maintained and synergized together. Technology is playing a significant role, definitely, but I totally agree with you. Don't let this crazy rush of technology applications that leads us to the unknown future. So we have to empower, to equip our staff, and to get them ready for the basic scenarios of sometimes we don't have the ability to apply technology. So how we are going to act, how we are going to prepare our basic healthcare services. It's absolutely correct. Yes, indeed, we are with the technology. We are with coping with all the new Internet of Things and the fifth industry revolutions and all these kinds of applications. Yes, it's impacting our business in a very important and beneficial results. However, when it comes to the healthcare, things are a little bit more sensitive. So both should be maintained, and we don't put the technology and prioritize to give it a priority in order to do better performance and do better services. However, your normal services should be trained and get your stuff into all the scenarios that maintain at the end of the time the people's life and to provide the proper service at the same time. It's very important to share this, and I think Omar has some comments before going to the questions.
Yeah, sure. Thank you for coming. To introduce myself briefly, my name is Omar Ahmed, and yes, in this board we have two Omar Hadras and Omar Ahmed. And thank you very much. We collectively thank you for giving us as students the opportunity to live vicariously through the eyes of a professional. You have a lot of expertise, it being professionally as well as in academia, and we felt this rush of knowledge very smoothly. So you got this beautiful mesh of like theoretical and technical knowledge. So we're really pleased and happy. I really, really enjoyed this presentation as a student.
And I would say, Omar, you can do the same.
Sure.
You can do the same.
And I really want to say that we felt the necessity of addressing such a topic because all of us know that health is the focal point of our lives, and without having it, nothing else matters. So we never had we seen this more importantly than after like COVID, the outbreak of COVID. We need to really understand the complexity of the issue and how we can like overcome disparities, turbulences, disturbances, whatever we can call it. So thank you so much, Professor, for helping us achieve our mission and enriching people with this collective info of like professionals.
You're most welcome. All I ask is that you go out and do wonderful things in your life and help other people and make the supply chain the best it can be.
Hopefully. So we are ready for all the questions.
I think Rahab, she raised Ahmed raised her hand. Okay, Rahab, go ahead.
Yes, I would like to thank Mr. Gerald for this lecture, and I took the opportunity because my son is one of the attendees. He is one of your students, Mr. Islam, and I took the opportunity to hear the lecture, and I gained a lot of information. I'm working in a shipping industry more than 20 years and involved in some parts of supply chain, but it was my first time to hear about the healthcare and the relation between health industries and the supply chain. What is the connection? Thank you for giving me this opportunity to hear about this relation, these important relations between both sectors. Thank you. I would like to thank
you're welcome.
all of you, really. Thank you.
You're welcome.
Thank you, Mr. Ha. Thank you very much.
I can take the next question.
Okay, go ahead.
Thank you first. Thank you, Dr. J, for accepting my invitation for this seminar.
Of course.
I want to ask you a question. What new technology advances can be in healthcare supply chain appear?
What technological advantage?
Yes. What is new technology can be appear?
Well, I think the utilization of blockchain all the way down to raw materials, especially as it connects to vendor contracts that are volume-based, because healthcare products are becoming very, very specialized, and there's a lot of raw and rare materials associated with them. So we need to better manage those rare materials and use them in the most efficacious way possible. So blockchain will hopefully allow us to do that. But we have to integrate the vendor contracts across the organizations, both from the distributor and manufacturer all the way to the healthcare provider. And there are some mechanisms in place like GHX, Global Health Exchange, where EDI goes through this Global Health Exchange for multiple transactions. But what we don't see is the volume burden at the contract level and how it relates to rare materials that need to be used on some of these patient items. Because some of the items that are used in patient care now are very specialized and they include rare items. And you will have disruptions, even in biological products. You know, ISG, where you need plasma from people to create these biological products, we only have so much. So we can't have our contracts outstrip the production. We got to have visibility in those things so that if we need to increase production where it can be increased, we need to know that early on so that we can meet the needs of the patients that are coming through the system, because the population of the globe is growing, but our resources are not. So we need to use a better mechanism to manage and to identify required substitutions to some of those items and get research and development on those problems earlier rather than later.
Thank you, Dr. Jerry. Noor have another question.
Hello, Mr. Jerry. Thank you very much about this presentation.
You're welcome.
But I want to ask a question about how data and analytic including artificial intelligence or Internet of Things, improve the ability to respond to the challenges or changes that occur in healthcare?
Well, I think we're just scratching the surface from artificial intelligence and how it can help us. The danger is artificial intelligence will only do what you tell it to do within its parameters. So you have to be able to see outside those parameters for opportunities. So I think the whole analytics space in the supply chain world, as well as in the medical world, is still very, very new, and we're still figuring out how to train people to look at those opportunities, and we haven't achieved that yet. So those are some areas that need to be explored and new programs put in place to help people connect the artificial intelligence information and the physical world and find where those intersections of opportunities come together. And then we need to learn to listen to those people. For example, in some of the climate issues we have today, some people have been saying this for many, many years. We did not listen to them until recently. But it's a very important area. That's still a lot to be explored in artificial intelligence, and getting to predictive analytics to proscriptive analytics, where it literally will say, we don't have to predict this. We know what's going to happen. Here's what you need to do. We're moving in that direction. And so we need to get prepared and train people to deal with that.
And sometimes I think it's taking the proactive stage rather than it's reactive or it's a reaction mode. So sometimes with using AI and Internet of Things, we are trying to, with all these analytics, that we are predicting models that will lead the next coming decades of business spectrum and the healthcare maybe overall performance when you go for the birth rate, the death rates, the diseases. So with using this technology is giving you another level of more precise prediction for future, and it sometimes can lead the future rather than that we are still waiting the impact of such maybe trials or some projects that be made in local or international markets.
Right, and one example of that, and I've seen this in several places now, where they are using pathogen monitors in sewer plants. They're looking for pathogen load in sewage water. So they can tell if a community is on the verge of an infection, and go in and give prophylaxis before the infection gets too big, and they can see it in the sewage water before it even becomes acute in the patient. That's partially AI plus human interface plus lab science. But it involves supply chain because you have to have a reactive supply chain to get those vaccinations or medicines to that community quickly. Great example is scarlet fever. If you know you have scarlet fever, which can be devastating to children, if you know you have a rise in that pathogen, you go in and give prophylaxis. Within 24 hours, you can destroy the disease for pennies per person. But if you let it erupt, you can have many children have problems their whole rest of their life. They're less productive and have many major problems, but you can knock it out if you find it early. For example,
great, Yasmin.
I'd like to know more about how healthcare supply chains can anticipate natural crises that could take place. So if an earthquake happens, how can I have my supply chain be more proactive to the amounts of patient intake that I can face?
There are models, and I've actually built some models myself. I have a whole book series on community preparedness that I did years ago as well. And I did the public health emergency preparedness assessment for the state of Georgia for 6 years. So there are modules and ways to have supply chain involved in your emergency preparedness program, and that should be integrated within your local, regional, and state government preparedness programs. And you need to keep track of what items are available locally, regionally, and nationally, and as well as globally for some items, so that you can get those materials to the right places quickly. So it needs to be an integration of information, and everybody needs to be a part of the emergency management program, which may mean you need to up your safety levels 5 or 10% across the board, so you have that flexibility to push things out. And it's really a national as well as a global requirement for people to, be responsible citizens to do that. But there are modules to do it. I'll give you some U.S. resources because I don't know I don't know if World Health has some. I'm sure they do. But FEMA, Federal Emergency Management Agency in the United States, as well as the CDC, Centers for Disease Control and Prevention, have emergency management modules. And AHRM has, which is the Association for Human Resource and Materials Managers Association, AHRM, it's the Association for Healthcare Resource and Material Manager Association, AHRM, AHRMM. They have, at least in the past, they had a small document about 70 pages on healthcare supply chain emergency management. So there are some resources out there, but a lot of those are probably online with FEMA in the U.S. or CDC in the U.S. And the World Health Organization may have some too. I would start there. But that's a very important area as well. So it's almost a specialty area, but you have to know supply chain well first, and then you can specialize in that area as well.
Yeah, that is true.
I think I can take one more before my next meeting starts, Omar.
Yeah, Omar, I think we can take Omar as a last question.
Yeah, thank you. So my question is directly related to Omar's question, which is the integration of AI when it comes to healthcare. So unless you've been living under a rock, you know that AI has been taking over other professions. So aren't we as professionals afraid of such consequences on healthcare? And is it ethically wise, how you think about it, and how we could hinder any problems that would come out of that?
Well, I think over time the professions will change that will incorporate better understanding of information resources to include AI, but you still need experts to standardize the human process, because until a human can walk in a building and never talk to anyone else and be cured, you're going to have people involved in the scenario. So I think, for at least the next 20, 30, 40 years,